Anasthasie Tudieshe in Kinshasa. Here in DRC, the country's main religious leaders are now officially part of the National Health Task Force. President Felix Tshisekedi has appointed them members of the newly created National Solidarity Fund against COVID-19, designed to seek and collect financial resources that will help support patients and caregivers. Meanwhile, the governor of the capital has made the wearing of masks compulsory for anyone walking in the streets of Kinshasa, promising to fine anyone who would not comply. And those who can't afford masks are expected to make them at home. As a consequence, more and more seamstresses like Marie Curie here can be seen sewing dozens of those and selling them 1,000 Congolese francs, that is 58 cents in dollars. Merci.
The heartbreaking effects of the national lockdown in South Africa are most striking in communities like Langa. The community lies just a few kilometers outside the Capetown CBD in the country's epicenter, where more than 1,700 COVID-positive cases have already been recorded. The South African government has set aside 500 billion rand to give some economic relief to the country's poor. But it doesn't appear as if that directive has filtered into communities like this. With a high unemployment rate and many unable to work even if they had a job, it's been a real struggle for families to put food on the table. This dire need has prompted local police officers to call on the assistance of humanitarian aid group Gift of the Givers to help distribute food parcels and issue daily meals to the elderly.
I'm Kiki Mordi here in Lagos, Nigeria, where residents have been mandated by the government to stay home in a statewide lockdown to prevent the spread of coronavirus. With local transmission of COVID-19 already recorded, Nigeria's National Center for Disease Control has intensified measures to try to flatten the curve. This impact doesn't spare local maternity hospitals like this enduring the cataclysm that comes with the pandemic. Gynecology departments in some public hospitals have been shut down, open only to emergencies. Experts fear a rise in maternal mortality rates and that this collateral damage might outlast the pandemic itself. The city may be on lockdown, but maternal health needs aren't. And as pregnant women distance from their caregivers, avoidable emergencies loom.
Maureen Ojiambo, and here in Nairobi, Kenya, COVID-19 cases continue to rise. Public transportation has been hit hard as normalcy has been disrupted. Public transportation system and matatus have been forced to limit the number of passengers on board, as passengers are being forced to wear masks so as one of the measures to combat COVID-19. It's not yet clear as to when the government will lift the restrictions as the COVID-19 cases continue to rise.